As your baby starts becoming more mobile, the risk of choking increases. Babies are notorious for picking anything up off the ground and putting it into their mouths. You're also introducing solids, which can increase the risk of choking on a piece of food. It's important to understand the difference between a partial and full airway obstruction. A baby who is truly choking, there will be no air exchange, the baby will not be able to cry or cough, may have bluish lips, and agitated body movements. This should not be confused with a partial blockage, where the baby's coughing is still optimally trying to expel the object. If you are certain that your baby is choking, and your baby is under 1 year old, do not hesitate. Immediately pick the baby up. Hold the baby's cheeks with one hand and flip the baby over onto his tummy with your arm in between the baby's legs. Straddle your legs to support the baby and make sure the baby's head is lower than its hips. And give the baby 5 back slaps with the heel of your hand right in between the shoulder blades. Often this does the trick to expel the object, but if it doesn't, flip the baby over, support the baby on the other knee, and give the baby 5 chest thrusts with 2 fingers just below the nipple line. 1, 2, 3, 4, 5. And you continue going back and forth with these 2 maneuvers, 5 back slaps, followed by 5 chest thrusts, until one of 2 things happens. Either this works to expel the object, the baby might start coughing or crying, or the baby might go limp. If the baby goes limp, immediately put the baby on a hard surface and begin CPR. You're performing CPR in this circumstance to help circulate the baby's blood, but you're also helping to expel the object. We'll start with chest compressions. Using 2 fingers, place them just below the nipple line and give 30 chest compressions, each one approximately 1/3 of the baby's body width at the rate of 100 per minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. As soon as you're done with those 30, look in the baby's mouth to see if the compressions dislodge the object. If you can see it, you may reach in and pull it out, but you should never do a blind finger sweep in the baby's mouth, running the risk that you'll push the object back down into the airway. Whether or not you see the object, you proceed by giving 2 breaths. So first you have to open the baby's airway by putting 2 fingers under the baby's chin and 1 hand on its forehead, doing what we call the head tilt chin lift. This opens the baby's airway. Make sure not to hyperextend the baby's neck, which can close the airway. We call this the sniffing position. And then open your mouth wide and place your mouth over the baby's nose and mouth and give 2 normal breaths. You may see some chest rise, but you probably won't. If somebody else hasn't already called 911, you should call 911 after completing 5 cycles of CPR, 30 chest compressions followed by 2 breaths. After calling 911, continue CPR immediately until help arrives. Infant choking and CPR classes are available everywhere. Parents find that by practicing these techniques, they feel more prepared if faced with a choking infant.